So have you been told that you've got a problem with a disc in your neck and you're not even sure what that means? Well, my name's Finnin. I'm a physiotherapist and the director of online.physio, and I'm here today to explain to you what all that means without all the big scary words. Okay, so our spine is made up of a series of blocks of bone and they're called vertebra. And in between those vertebra are the discs. So the top 7 vertebra make up our neck. And as you can see on George here, that there are little discs in between each of those vertebra. Now in the neck, the most vulnerable area in terms of discs becoming irritated seems to be at the base of the neck. So let's explain a little bit more about what the disc looks like in the neck and what can go wrong. Okay, so as I said, the discs are located between the vertebra. So if we looked at the vertebra in the neck, a basic graphic version of them, they look a bit like so. Much bigger version, of course. And in between the vertebra sit those discs. Okay, now the discs themselves are like rings and rings of concentric fibrous tissue, and then right in the middle they have a little pocket of jelly. That's what allows it to have shock absorption and also allows our vertebral column to have the ability to flex and move. Now, when we're upright, this is what things look like. But as soon as our head comes forward from our body, so if we're sitting or we're reading or we're looking down at an activity, what happens is this. The vertebra at the very base of the neck, or the top of your upper back here, is in one position, and because our head's forward, the next vertebra along tips forward a little bit. Now what that does to the mechanics of the disc is compresses it at one side, this being the front, and it forces that jelly nucleus to move towards the back of the disc. Now this is completely normal and it's a beautiful design. We're designed to flex and move, and this is what's designed to happen. When we tip our head backwards, the disc will move in the other direction. But unfortunately with our lifestyles, we're predominantly in set postures. Okay, so more than ever we're sitting at computers or we're sitting looking down at things. So unfortunately we're spending a lot more time with our discs in this position than we used to. Now if we look at a cross section of the disc now, so from a bird's eye view of this disc for example, it would look a little like this. So it's shaped a bit like that if that's the front and that's the back. So our spinal cord sits in behind the disc here. So as I said, rings and rings and rings of fibrous tissue and that pocket of jelly sitting right in the middle. Now over time, as this happens, as we have more pressure put on the back of the disc from our neck sitting forwards, tipping one vertebral body forward on the next, we see that jelly pressing on the back wall of the disc, and over time this causes little fissures or little tears in the back wall of that disc. Now this can be happening without you having any pain at all. Why? Because the nerves that pick up on pain messages are only located on the very outer rim of the disc. So damage to our discs can be happening without us having any pain at all. Until such time as the amount of damage builds up to the point where it then causes some swelling in the back wall of the disc. So that is the day that our brain starts to perceive the pain. It sends a message to our brain saying something's wrong. Our brain often just sends a big message saying tighten up the muscles to protect it till we work out what's going on. And it's when your health professional gets involved that you can break down that tightness and get the movement back going again. So as we've discovered, it's a lot of this sort of forward head type posture loading up the vertebra and the disc like so that has got us into this problem in the first place. So often the way to remedy or get that disc better is to bring things back into line, and your health professional will advise you on the right exercises to do to assist with that. It's a lot around posture, it's a lot around exercise, and also just general activity. You may need to modify them somewhat, but it's very important to keep generally active and moving within your limits. So basically what we want to do is give the back wall of the disc a chance to settle down. We do that with those positions and postures, and medication can help as well with advice from your GP or pharmacist. So If this damage is very severe, which is in only a very few situations, very few circumstances, then this is our spinal cord here, and there's a nerve that exits either side right next to our discs. If this swelling is such that that nerve is getting tickled, that's when you may feel some symptoms in your arm, some pins and needles or numbness, perhaps some weakness or some, aching or pain. So in those situations, we do have to tread a lot more lightly because there are nerves involved. So follow your health professional's advice. Having said that, in the majority of cases, it's just a minor bit of swelling in your disc. It's very common and it's easy to manage as long as you do the right things by it. So follow your health professional's advice in terms of medication, in terms of exercise, and in terms of your general activity and what you should and shouldn't be doing moving forward. I hope that sheds a little bit of light on why your neck's been so sore and how you can move forward with getting it better. I look forward to chatting to you next time. Bye.